Well, hello, my friends. It's Dr. Pete here, and today I want to just bring your attention to a simple word known as perception. I have seen so many sick people for so many years in my clinic, and it has always made me think to ask the question, to myself, of course, what on earth is wrong with these people's bodies that they're coming in for some help? I mean, why are their backs a problem? Why is their digestive system not working as good? Why is their blood pressure up? How come they have diabetes? You know, I don't seem to see a lot of other people asking these questions. It just seems in healthcare we just treat it. Find out what it is and try to affect it. If the blood pressure's up, give them a drug to drop the pressure down. But we never truly ask the question, why is it up in the first place? But this is what I've learned. This is what I know to be true now after all these years of doing this. Probably about 10 years ago, I started to see this, and I've been chasing it ever since and becoming more and more aware of what the problem is. And it really is about perception. It's about finding yourself feeling awful. And that feeling that you have, the feeling awful, is your fault. Yes, I just said it. It's your fault. It's based upon your perception. If you see things in your life as a negative and all the situations around you are awful, and then you begin to believe other people's perceptions of what they believe because they're trying to drag you into their world, then you get lost. And when you're lost, you're out of control. When you're out of control, you eat the wrong things, you drink the wrong stuff, you stay up too late, you don't do the things you're supposed to because you're out of control. So I'm telling you this, please, if you can get anything from my videos, remember this simple thing, that perception is the key to life. It always has been. Your parents started off teaching you how to perceive the world around you. Sometimes your parents didn't do an adequate job, and therefore the way you see the world today is very negative. Any situation that you might see, your first knee-jerk response is negative. And with those negative perceptions, you're risking serious health issues. And then the health problems will feed back to the brain, making you feel awful, which will then alter your perspective or your perception even worse, until you finally get a diagnosis of something that wants to kill you, and the physicians of the world want to treat the illness, they don't want to treat the cause. Most of the people I see, and by the way, most research journals believe the same thing, that over 90% of people that go to the doctor every day, they're there because of some negative perception that causes stress. That's what it is. That's what I see every day in my practice. A guy or a girl comes in and says, I have a pain somewhere, wherever it might be. And I go, what's causing that pain? Is it a secretion of chemistry from the brain, meaning that your brain is activating certain processes of chemicals, which then make your body feel like crap? Yeah. Yeah. Yes. 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 That's it. You're like, you kidding me? That's it? Yep. Yep. Optimists live 7 years longer than pessimists on average. What is the difference between an optimist and a pessimist? It's certainly not the color of your skin and your gender. It's not where you come from in the world. It's simply how you use these two eyes and this brain to perceive the world that you live in. If you perceive the world in a positive way, then your blood chemistry will shift towards very joyful, happy, blissful chemicals. Vasopressin, oxytocin, dopamine, serotonin. These are wonderful chemicals that humans just really can't wait to feel. It's like if you're a parent and you hug a kid, you're releasing those chemicals. That's a good feeling, right? So any time that your perception is negative, you secrete negative stress hormones into the bloodstream and they sicken your body. When you secrete, or should I say, when you see the world in a more positive light and find joy in things rather than pain, then your brain secretes the chemistry to the bloodstream that helps to heal the body. You are, and always have been, in complete control of your health. Yes, there are a very small percentage, less than 2% of the world has genetic mutations which cause their body to be sick. The other 98% of us are just dealing with garbage of life, and the biggest piece of that is the way that you interpret the world through your eyes, what you see. And some will say, well, I've been abused my whole life, so this is the way I see it. I understand that. I just want you to know that you don't have to be the victim for the rest of your life. at any time you want to become the warrior, just do it. And how do you become a warrior? You just change the way you see things. You start being more loving towards things. You get people around you to surround you that have good, positive outlooks on life, and pretty soon you'll have them too. Maybe you wind up in a physician's office like mine where we talk about it, we dialogue. Yes, I'll work on your tissues and the things that aren't so good, but the thing that's driving it, the catalyst that makes you really go, so to speak, and that could be go good or go bad, it's your perspective. So this week, I want you to think about every situation that you come upon. You stand in Dunkin' Donuts, you want to get a coffee, and there's two old ladies in front of you that are pulling pennies out of their purse, and it's taking forever. And you want to be upset because you got to get to work, so you get a little snippy and angry. I mean, come on, you're making yourself sick. Why not just go up and ask the old ladies if you might buy them breakfast today? And they go, oh, honey, thank you so much. The world needs more people like you. God bless you. And you leave going, oh, cost me $5 to just feel good. Yes, it's perspective. It's always been perspective. Work on your perspective during this week and going forward so that every day you get more skilled at seeing the good in things rather than the bad in things. I'm not to say that the world doesn't have bad things in it. And I'm not to say that you're going to be perfect purveyor of your visual interpretation of the world every second of your life. We are human, and it hurts sometimes, and sometimes we get a little pissed. But after you get pissed and after you've dealt with that moment, back off, reevaluate, and then find the positive perspective. In doing so, you will enrich the people around you, and then you'll enrich your life and your health. And that's the key, because when you lose your health, you lost your life. That's all I got. Just want to get through real quick today. My friend Bruce W. said I was too winded last time, so I cut it down. There you go, Bruce. Thanks for your feedback. I want to say hi to Gordon. I love Gordon. He's still watching me. Thank you very, 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 very much. Who else did I want to say hi to? Marie. Marie, you know who I am. I mean, I know who you are. You know who I am. One of my patients who has done very, very well through our conversations, through perspective. And probably the biggest shout out of all is to my buddy Danny O'Connor. Big Danny, boxing legend here in Boston. One of my favorite people of all time. Reached out to me the other day through a text message. We were just thinking about each other. And Danny, I just want to say, thumbs up, brother. You're always on my mind, you're always on my heart, and I wish the very best for you. I wish all of you a happy week, work on your perspective, and I'll see you next time here. Dr. Pete, I'm out.